Okay, this video will be covering different types of stroke. So there are two main types that are one is ischemic and one is hemorrhagic. So now these terminologies and their definitions are very important to understand because if you're working in the chronic or I'm sorry acute or subacute setting, you might see a lot of clients with the stroke lines, and then when you read the medical chart, you'll see they'll be using ischemic or hemorrhagic. If it's ischemic, what kind of ischemic stroke? Now, if it's a ischemic stroke, that means there's a blood clot that is stopping the blood to go further, or is occluding the artery, and which will cause a lot of tissue damage or dead brain cell. Now, there are two types of ischemic strokes. One is thrombus or thrombi. Now, the thrombus is a clot forms in the brain. So atherosclerosis is one of the process when there's high cholesterol. It's going to be uh, lodging in the artery, and it's going to keep getting bigger and bigger. When it ruptures a little bit, the blood clot form on top of it, and it stops the blood supply to the brain. So thrombic or thrombus is formed inside the brain. Inside the brain, okay? Again, if you have high cholesterol, it's very dangerous. That's what it can cause thrombus. It can stop occlude the artery inside the brain. Now, embolic stroke is different than thrombus. The mechanism is different. Like embolic stroke is a caused by wandering clot. Now, that blood clot can be formed anywhere in the body. Usually, it's formed in the heart. If a patient has a heart disease, such as AFib, it's common with AFib clients. They might be on the blood thinner because the blood clot, the blood is not pumping correctly, and there is a blood clot on the chamber or wall, so it comes in the let's say carotid system. It comes up and it goes up in the brain, and it lodges in one of the arteries. Okay, and it's gonna occlude the artery. So again, both of both types are occluding the artery, stopping the blood supply, but one thrombus is forming inside the brain, but embolic or emboli is coming from other part of the body. It's wandering around in the blood system, and wherever is want to lodge, it's gonna stop there and stop the blood supply. Now these two are the types of ischemic strokes. Now if the hemorrhagic strokes is the blood spill inside the brain, or if the weak blood vessel ruptures, it's going to spill blood in the area of the brain, causing uh, other tissue to compress, which will cause a lot of, again, it's going to cause brain tissue damage, or brain tissue, there'll be a dead brain tissue, and it will stop the blood supply to the further arteries. So there are different types of hemorrhagic stroke. Subacromial, which is a blood vessel on surface. It's not in the brain, but it is on the surface of the brain. Now, if it ruptures, it's gonna accumulate the blood on top, spill the blood on top, compress the tissue. It's gonna decrease the blood supply, and actually there'll be a brain damage because of that. So it's subacromial. The other one is intracerebral area or stroke, which is a blood vessel burst inside the brain, within the brain. Okay, intracerebral is in the brain, the rupture of a brain vessel in the brain, and the aneurysm, that's the weakening in the blood vessel wall. So aneurysm can happen on the both sides of the wall, or it can happen on one side of the wall, depending. Again, aneurysm happens because of the high blood pressure, hypertension. If you don't treat hypertension, that can result in aneurysm. So there'll be the blood vessel will get dilated, okay, and over time it's gonna just pop open. That will be an aneurysm, okay. Subdural hematoma, that's the bleeding below the okay, the structure of the brain has dura mater, that's the top, and then the acronoid, then the pia mater. So this hematoma, subdural hematoma, will happen in the bleeding between one of the surface, such as dura layer. Okay, it happens after the traumatic brain injury. Okay, so the blood accumulates under dura mater, compressing the brain tissue, which cause the stroke, the hemorrhagic stroke. Again, with a lot of damage to the brain tissue. And causes of hemorrhagic stroke is usually, mostly, if it's an aneurysm and other strokes, it's hypertension or high blood pressure. Now, it can be trauma also, as I mentioned in subdural hematoma. All right, so I do have some of the explanation here. Same, I'm explaining right here. So embolism, stroke, which is ambulus. So emboli is traveling in the artery. Okay. So thrombi is a plaque development in a vessel wall inside the brain. Okay. Now, what are lacunar strokes? These are the strokes. These are ischemic strokes, which occur within the small single artery in the deep cortical areas of the brain. You know, as I mentioned before, the striate arteries that are deep, providing blood to the deep structure of the brain, they're very thin and long. Now, what happened with the high blood pressure? The walls will not be able to tolerate the blood supply, the red blood cell coming in the wall. So what they do, they try to thicken the walls so they can tolerate the blood pressure. So when they thicken the wall, they get so thickened that they obstruct the blood supply, and that's the lacunar stroke. Again, so small deep structures, small arteries, very small arteries, such and they're supplying blood to basal ganglia or pons, like striate arteries. So what happened with the high blood pressure? They cannot tolerate. So what they do, they try to thicken. The body works with it, and the body actually modifies the arteries, and they thicken it, the walls of the artery, which results in occlusion. They get so thickened that the blood cannot even go from the artery. That causes lacunar stroke. Now, what is ischemic penumbra? Very important. Is okay. So now, when the ischemic stroke happens, there are two major zones. So one is a core ischemic zone, and one is ischemic penumbra. So let's watch the video for a few minutes. We'll explain further.
So we know that when a cerebral artery gets blocked, the brain tissue that vessel serves can die off pretty quickly. The neurons die off without the oxygen that they get from their blood supply, right? And that's what a stroke is. Well, it turns out that what we see is this interesting pattern in brain tissue that's undergoing a stroke. Essentially, we see two different, almost zones of injury. So there's a zone closest to the artery that's been blocked off, called the ischemic core. And there's a zone sort of on the periphery of the core called the ischemic penumbra, which is ischemic but still viable cerebral tissue. And before I sort of explain these two areas, let's draw it on the other brain here. So notice that this here is the left-hand side of the brain. Here's the right-hand side. And we're actually looking at this brain from a left-hand view. So that works out nicely. So on this view, what we'd see is something kind of like this. So we'd see the ischemic core here in the distribution of the middle cerebral artery, because that's what's been blocked. And then we'd see the ischemic penumbra just sort of surrounding the ischemic core. So let's talk about the core first. So in this core zone, when there's severe ischemia, which is defined as blood flow of less than about 20% of normal, you get this massive loss of two vital nutrients for our neurons and their supportive cells. So you get this loss of oxygen and glucose, because they use up what's in the area already, and then they're not getting any more replenished because there's no more blood flow. So what will ultimately happen is that the severe ischemia will cause these neurons and their supportive cells to die off, which is also called necrosis. And this actually happens in only minutes. It only takes a few minutes for the core neurons to die off. So what about the penumbra? Remember I said there are two different zones. The penumbra is this almost rim of moderately ischemic tissue that lies outside the core zone, between the core and the normally perfused brain tissue. The tissue in the penumbra won't actually die right away, because what's happening, remember I said it's moderately perfused tissue, what's happening is that it's getting some blood still from nearby arteries, referred to as collateral arteries. Right? You can imagine that oxygen is diffusing out of these blood vessels and still serving neurons in this ischemic penumbra. These white dots are my representation of oxygen diffusing out of these collateral blood vessels. So good, these penumbra neurons get some glucose and oxygen from collateral arteries. But the catch is that it won't last forever, and in fact these neurons in the penumbra region will still die off if blood flow isn't re-established pretty early on, like within a few hours of the vessel obstruction happening. And that's because this collateral circulation still isn't enough to maintain the oxygen and glucose needs of these penumbra neurons, past a few hours. So just two more penumbra things I want to touch on here. So first, the more collateral blood vessels you have, then the more penumbra neurons you have, which is a good thing, because that means that neurons aren't just outright dying off. And of course, those collateral arteries have to not be blocked off as well. So for example, in this drawing here, this penumbra is allowed to exist because this collateral artery is still patent, open, and this collateral artery is still open. However, if the blockage happened, say, down here, right before each artery comes off, then of course none of those arteries would have blood in them. So then this particular penumbra wouldn't exist. All of this would just be more dead core. Although then there might be some other collateral vessels creating a different penumbra. Like maybe this vessel and this vessel. These would then be the new collateral arteries for that newly created ischemic core. So let's put that down here. More collaterals equals more oxygen to neurons at risk of ischemic death. And the second thing is that the penumbra is the area where medications are most likely to be effective. So what does that mean?
Okay, so ischemic penumbra is still the tissue which is still a little bit viable and can be restored if the intervention is provided on time, okay? But it might die if the intervention is too late. So ischemic penumbra is the outer layer or the distal part of the ischemic zone or the core zone.
Of treatment.
Okay, so again, a little bit outline of hemorrhagic stroke again. So intracerebral was again the blood vessel bursts or ruptures within the brain as a small vessel disease. Aneurysm is the dilation of a wall of an artery. So it occurs when it's dilated or swollen and it bursts open in the brain. It usually occurs in the brainstem and weakening in the blood-brain, usually brainstem. So AVM, okay, intravenous malformation are abnormal tangles of blood vessels. So what happened in AVM that capillaries are not present. So there's a system that fresh oxygen come in, and with the other artery, the oxygen goes, deoxygenated blood goes back to the heart. But with the AVM, there's an abnormal tangle of the blood vessel, and there's the absence of capillaries where the oxygen will be coming out and going to the tissue, which will give nutrition to the tissue. But in this setup, the capillaries are not there, which means the tissue is deprived of oxygenated blood. That is called AVM. Subarachnoid, that's the hemorrhagic stroke happens when blood vessel is on the surface of the brain ruptures and bleeds, okay, and which results in the blood spillage in the surrounding area. The subdural hematoma again is from the trauma like TBI, like a car accident, you hit your head, the blood accumulates under the protective layer, which is dura mater, and it compresses the brain tissue. So what is hemorrhagic conversion? Very interesting topic here. So what happens if the client goes to hospital with the ischemic stroke, okay, and because of the ischemic stroke, that means there's a blockage of blood flow, right? The part of the brain is not receiving blood because there's a blockage. Now that will result in the brain cells to die. Okay, some of the brain cells will die because of the occlusion. Now, treating the ischemic stroke in a certain window period is effective. However, sometimes it can also result in hemorrhagic stroke or hemorrhagic conversion. So when the brain tissue is dead, and the surgeon or the physician will provide treatment to open the blood clot, to remove the blood clot, the blood will flow inside those arteries, okay? And now those arteries didn't receive the blood, the tissue, they were dead, they didn't get the oxygen because of the blood clot before. Now those arteries are not able to retain the blood in them, which will result in spilling the blood out. which will result in, so as we know, hemorrhagic stroke is the spill of the blood. So that results in hemorrhagic stroke or hemorrhagic conversion.